Can pacifier use delay speech? If you're a parent wondering whether using a pacifier could affect your child's speech development, you're not alone. Let's break down the facts to help you make an informed decision. Pacifiers can be very helpful for babies, especially in the first year. They can soothe your child, help with pain, and even reduce the risk of sudden infant death syndrome, SIDS. However, when it comes to speech development, the picture gets a bit more complicated. Excessive use of pacifiers, especially beyond the age of 1, can have some negative effects. Here's why. When your child is using a pacifier during the day, they have less time to babble and practice their sounds. Babbling is crucial for language development, as it helps your child learn how to make different sounds and eventually form words. Another issue is that having a pacifier in their mouth restricts the movement of their tongue and lips, which are essential for proper speech. This can lead to articulation errors, especially if your child tries to talk with the pacifier in their mouth. For example, sounds that involve the teeth, like f, can be particularly hard to pronounce if your child is used to having a pacifier. Additionally, prolonged use of pacifiers can increase the risk of ear infections, which are linked to delays in speech and language development. Dental problems are also a concern, as extended pacifier use can affect the alignment of teeth and the shape of the palate, leading to speech sound production errors. So what can you do to ensure your child's speech development isn't affected? Here are some tips. Start weaning your child off the pacifier between 6 and 12 months. Introduce other soothing methods like music, walks, or favorite toys. Limit pacifier use to sleep and nap times only. Make sure the pacifier is clean and designed for your child's age. Avoid dipping the pacifier in sweet foods to protect your child's teeth. Don't let your child talk or babble with the pacifier in their mouth. If your toddler is still using a pacifier and you're ready to stop, you can try a few creative approaches. For instance, you could tell your child that when they turn 2, they won't need the pacifier anymore. You could also involve a fun story, like a fairy collecting the pacifier and leaving a treat in exchange. In summary, while pacifiers can be beneficial, excessive use beyond a certain age can indeed impact your child's speech development. By being mindful of these guidelines and limiting pacifier use, you can help your child develop healthy speech habits.